So let's take a look at some of the typical things that people take and do and eat. Some are good for us, some are not good for us. And let's ask how much dopamine is increased above baseline. Now, of course, these are averages, but these are averages that have been measured in so-called microdialysis studies in animals, so actually extracting from particular brain areas how much dopamine is released, or from measuring the serum, the circulating levels of dopamine in humans. Chocolate. They didn't look at milk versus dark chocolate, but chocolate will increase your baseline level of dopamine 1.5 times. Okay, so it's a pretty substantial increase in dopamine. It's transient. It goes away after a few minutes or even a few seconds. I'll explain what determines the duration in a minute. But 1.5 times for chocolate. Sex. Both the pursuit of sex and the act of sex increases dopamine 2 times. So it's a doubling above baseline. Now, of course, there's going to be variation there, but that's the average increase in baseline dopamine caused by sex. Later, I will talk about how the different aspects of the so-called arousal arc, the different aspects of sex, believe it or not, have a differential impact on dopamine. But for now, as a general theme or activity, sex doubles the amount of dopamine circulating in your blood. Nicotine, in particular nicotine that is smoked, like cigarettes and so forth, increases dopamine 2.5 times above baseline. So there's a peak that goes up above baseline 2.5 times higher. It is very short-lived. Anyone who's ever been a chain smoker or observed a chain smoker understands that the increase in dopamine from nicotine is very short-lived. Cocaine will increase the level of dopamine in the bloodstream 2.5 times above baseline. And amphetamine, another drug that increases dopamine, will increase the amount of dopamine in the bloodstream 10 times above baseline. A tremendous increase in dopamine. Exercise. Now, exercise will have a different impact on the levels of dopamine depending on how much somebody subjectively enjoys that exercise. So if you're somebody who loves running, chances are it's going to increase your levels of dopamine 2 times above your baseline, not unlike sex. People who dislike exercise will achieve less dopamine increase or no increase in dopamine from exercise. And if you like other forms of exercise like yoga or weightlifting or swimming or what have you, again, it's going to vary by your subjective experience of whether or not you enjoy that activity. This is important, and it brings us back to something that we talked about earlier. Remember that mesocorticolimbic pathway? Well, the cortical part is important. The cortical part actually has a very specific part, which is your prefrontal cortex, the area of your forebrain that's involved in thinking and planning and involved in assigning a rational explanation to something and involved in assigning a subjective experience to something. All right. So, for instance, the pen that I'm holding right now is one of these Pilot V5s. I love these Pilot V5s. They don't sponsor the podcast, but I just happen to like them. I like the way that they write, how they feel. If I spent enough time thinking about it or talking about it, I could probably get a dopamine increase just talking about this Pilot V5. And that's not because I have the propensity to release dopamine easily. It's that as we start to engage with something more and more, and what we say about it and what we encourage ourselves to think about it has a profound impact on its rewarding or non-rewarding properties. Now, it's not simply the case that you can lie to yourself and you can tell yourself, I love something, and when you don't really love it, and it will increase dopamine. But what's been found over and over again is that if people journal about something or they practice some form of appreciation for something or they think of some aspect of something that they enjoy, the amount of dopamine that behavior will evoke tends to go up. So for people that hate exercise, you can think about some aspect of exercise that you really enjoy. However, I will caution you against saying to yourself, I hate exercise, or I hate studying, or I hate this person, but I love the reward I give myself afterward. Later, we're going to talk about how rewards given afterward actually make the situation worse. They won't make you like exercise more or studying more. They actually will undermine the dopamine release that would otherwise occur for that activity. So certain things, chemicals, have a universal effect. They make everybody's dopamine go up. So some people like chocolate, some people don't, of course, but in general, it causes this increase in dopamine. But sex, nicotine, cocaine, amphetamine, those things cause increases in dopamine in everybody that takes them. Things like exercise, studying, hard work, working through a challenge in a relationship, or working through something hard of any kind, that is going to be subjective as to how much dopamine will be released. And we will return to that subjective component in a little bit. But now you have a sense of how much dopamine can be evoked by different activities and by different substances. One that you might be wondering about is caffeine. I'm certainly drinking my caffeine today, and I do enjoy caffeine in limited quantities. I drink yerba mate and I drink coffee, and I love it. Does it increase dopamine? Well, a little bit. Caffeine will increase dopamine to some extent, but it is pretty modest compared to the other things that I described: chocolate, sex, nicotine, cocaine, amphetamine, and so on. However, there's a really interesting paper published in 2015. This is Volkow et al. You can look it up. It's very easy to find. That showed that regular ingestion of caffeine, whether or not it's from coffee or otherwise, increases upregulation of certain dopamine receptors. So caffeine actually makes you able to experience more of dopamine's effects. Because as I mentioned before, dopamine is vomited out into the synapse or it's released volumetrically, but then it has to bind someplace and trigger those G protein coupled receptors. And caffeine increases the number, the density of those G protein coupled receptors. Now, sitting back and thinking about that, you might think, oh yeah, sometimes I'll notice people, at least in the old days, that it used to be a cigarette and a cup of coffee. Or when people drink alcohol, oftentimes they'll smoke. And it's well known that different compounds like alcohol and nicotine, or caffeine and nicotine, or certain behaviors and certain drugs can synergize to give bigger dopamine increases. And this is not terribly uncommon. There are a lot of people nowadays who, for instance, take pre-workout energy drinks. They'll drink I won't name names, but they'll drink a canned energy drink, or they'll drink a pre-workout, and they'll try and get that big stimulation, that stimulant effect for the dopamine, the norepinephrine, that family of molecules that works together to make you motivated. And then they'll also exercise to try and get even more of a dopaminergic experience out of that workout. Sometimes it's also to perform better as well, of course. But as we'll talk about in a few minutes, that aspect, or that approach rather, of trying to just get your dopamine as high as you possibly can in order to get the most out of an experience, turns out to not be the best approach. And what you'll find as we talk about dopamine schedules is that layering together multiple things, substances and activities that lead to big increases in dopamine actually can create pretty severe issues with motivation and energy right after those experiences, and even a couple days later. So I'm not saying that people shouldn't take the occasional pre-workout if that's your thing, or drink a cup of coffee or two before working out now and again. Some people really enjoy that. I certainly do that every once in a while. But if you do it too often, what you'll find is that your capacity to release dopamine and your level of motivation and drive and energy overall will take a serious hit.